Hi guys, I'm Sonakshi from Clinicking Minds, and I'm going to be taking a few questions that you all have been asking me as a clinical psychologist, as a healthcare professional, as somebody who is going to be soon stepping into the field because I'm going to be getting my license very soon, so I'm very excited. But yes, I will be taking a few questions that you all have been continuously DMing me and asking me, so I'm going to be taking those up and we can have a chat post that, and if there's anything more than that you want to ask me, you're free to do that, right? So starting off with the first question is, what kind of cases do we see in a clinic setup while we're doing clinical psychology? So you will be seeing all types of cases in your practice, starting with any and every type. So I so far in my practice have seen cases of disassociation, schizophrenia, bipolar, body dysmorphia, conversion disorder, of course depression, anxiety, generalized anxiety disorder, social phobias, personality disorders. That's my area of interest. Also, I've seen multiple cases under that. Like, I did my thesis on a borderline personality, so I had my entire data collected on that. So personality disorders, a lot of cluster B. So you will be seeing different types of conditions and psychosis, neurosis, both. Since I work in a multidisciplinary disciplinary hospital, I kind of ended up seeing a lot of these cases and cases from other wards as well. Like, we used to get case referrals from oncology ward, from the nephro ward, for dialysis when the patients come, or when they need to get a transplant done, so we kind of have to do the fitness for that, right? So all of these different types of cases I have seen. Apart from this, there were also a lot of child cases that we saw. There were cases of autism, ADHD, neurosis and corporisis. I've seen all of these cases in our practice as well. Psychogenic conditions, secondary gains. So all of these different types of presentations we have seen in our working. We've done multiple IQs. So you'll get a lot of exposure in your M.phil, so don't worry about that. In my hospital, primarily because it was multidisciplinary, I think we got a lot of different cases from different areas, different departments. But yeah, it's a very common occurrence and you will be seeing that. Apart from that, we had a lot of record work to do, so we used to be seeing records, and you have to submit 5 cases at the end of the year, which will be your your, we call it our punji, because we literally had to it was Lakshmi for us at the end of it, that oh my god, hamare 5 cases. So yeah, 5 psychodiagnostics at the end of first year, 5 psychotherapeutics at the end of second year. So you will be doing that as well. Apart from that, you have to write your daily logs, and apart from that, you also will be having exams. You will have 2 sets of internals and then your final exam. So that's basically how the structure for M.phil works, and this is the exposure that we got. And apart from that, you will be getting a lot of ward cases as well, so you can get a chance to see ward cases, and sometimes you'll have to give reports instantly. But every hospital and institute works separately, so differently, so you will have to check from your institute, with your institute, how it works there wherever you're applying. Another question I got asked was language. So I did my M.phil in Ramachandra, as you can see, and there obviously we primarily speak in Tamil. So I'm born and brought up in Chennai, so I never really had a problem with the language, because Chennai is my birthplace and I was already good with the language, but I picked it up even more in my M.phil. And you will, whichever place you go to, and I kid you not, you will pick up the language if you are studying in that place, because all the cases are mostly going to be coming in the regional language, so it's going to be very easy for you to pick up the language, so don't worry about that. Yeah, apart from that, how much time did I get during my M.phil? I don't have an answer to that, because it's been very, very packed, the course. We used to get time on the weekend sometimes, but it really depends on how much work you have, right? So the day can end at any time depending on your institute. So for my institute, luckily for us, 4 o'clock we shut shop, and we do not work more than that until and unless you have like some ward case that you need to follow. Then you kind of have to go for duty later as well and like follow up on it. But apart from that, it's not really something that is mandatory that you have to sit there post 4 o'clock. So 8 to 4, definitely you have to be there every single day. No government holidays, nothing. We don't get anything. We get our holidays are on roster basis, but holidays are, there's no such thing called holidays in M.phil. So that is something, I think that's a very common thing that I've heard from all my friends in M.phil. So you're working all the time, like there is no break and all of that. We get Sundays off, but I know institutes that work on Sunday as well, which is just sad. But yeah, that's how it is pretty much. And I've told you about the structure, I've told you about the holidays, I have told you about what and all we cover in the course, how the exposure is like. Clinical hours are very important to meet, which is why we have so many extra hours, and we don't get any holidays and we need to work. So as per RCI's requirement, we have to do all of these things. Only on the basis of that will we get our license, right? So it is definitely very, very, the scrutiny is, it's quite bad, but at the end of the day you get a very good result, which is your license. So we work really, really hard these 2 years to achieve that. And the reason why I actually also wanted to add this was that as a person who's done her MPhil, as a person who's in the last leg of her journey, I would like to just say one thing, that these 2 years have taken away a lot of things from us. And we've lost touch with family, with friends, with close ones, and any course in the world would be like that, right? It's definitely hard. I mean, I've done masters, we've done undergrad, it was difficult, but MPhil is something else. And there is no crown on our head for having done this degree, not at all. But the only thing we expect is people who've not done the course, please don't do the same thing that we're doing outside unethically, because you do not have the experience to do it. I actually wanted to talk about how rigorous this course is, also to let the people who are unethically practicing as clinicians know how hard the journey is for us. And for these 2 years where we cut ourselves off from the world and we're just engrossing ourselves into this course, when we step out and we go into the world and we see that there are people who are not licensed and they are still doing things that we're doing without having a government license, and doing unethical diagnosis, assessing people, giving therapy to patients who are a clinical population, and all of those things, it really saddens us, because we worked really hard for this. And I really think that we deserve the credit for it, right? So don't take that away from us. And it's really unfair, to come outside and then meet people who come to us and say that, yeah, but I got this diagnosis from a counselor, or I got this diagnosis from some other healthcare professional, and we just look at them and we're like, yeah, but how did you get the diagnosis? Or like, they've diagnosed you wrong, or on what basis was this done, or was there any clinician on board? So the person says no, and that really saddens us. So don't do things that are not in your domain of expertise, or that are outside of your domain of expertise. That's like us, coming outside and giving medication, which is something that we cannot do, because I am not ethically licensed to give medication to patients. I'm never going to do it, because that's something, nobody in the field is allowed to, and if they are, then that day can be reported. But it's something that I wanted to just put across, because these 2 years have taken a lot from us. And sorry. So to just find people who don't do that journey the way we have, and they just go ahead and practice and do whatever they want in their capacity to just make money and spoil the lives of our patients and really tarnish the field in general, it saddens us as professionals. So that's just something I wanted to put across. And any other queries you have about MPhil, please reach out to me, and I'll always there to help you out. See you later. Bye bye.